My name is Meghan Doherty. I'm the Director of Global Policy and Advocacy with Action Canada for Sexual Health and Rights, which is a partner of the SRI. So Action Canada has been working on the preventable maternal mortality and human rights resolution since its inception, and actually even before that, where the Special Rapporteur on the Right to Health actually wrote a report looking at the human rights dimensions of preventable maternal mortality and morbidity. And through a great coalition of civil society, UN agencies, and states, the first resolution recognizing that preventable maternal mortality needed to be addressed from a human rights-based approach came to the Council, and it has been running for over 10 years now. So states should be very concerned about the human rights dimensions of preventable maternal mortality and morbidity because it features very prominently within global policies, and for a long time it was only considered to be a health issue. It was not considered to be a human rights issue. And it was only through looking at the ways in which women and girls' rights were being violated, particularly their sexual and reproductive rights, that states began to be able to conceive of different kinds of interventions that would help before, during, and after any sort of critical intervention. The resolution that was negotiated during the 39th session of the Human Rights Council on preventable maternal mortality and human rights focused on humanitarian settings. It looks at what are the existing issues of discrimination and barriers that women and girls face when trying to access sexual and reproductive health services, but also in relation to the realization of their reproductive rights, and then how that becomes exacerbated in humanitarian and crisis settings. So this resolution was difficult to negotiate, primarily because any mention of women's rights, women's autonomy, sexual and reproductive rights tends to be quite contentious within intergovernmental negotiations. And so we have several areas within the resolution that were strongly contested, but ultimately resulted in adoption by consensus. And some of these issues include comprehensive sexuality education, access to sexual and reproductive health services, recognition of women and girls' bodily autonomy, also looking at issues of unsafe abortion. And we know that unsafe abortion is one of the major causes of preventable maternal mortality and morbidity. So the debate centered primarily around these issues, and through great work and by a lot of people, the resolution reaffirms a lot of these issues and hopefully will be able to be used to protect, respect, and fulfill women and girls' human rights.